Hi, in this video we'll be talking about osteoradionecrosis. Radiation has revolutionized medicine and is a useful tool in the treatment of various cancers. Radiotherapy indiscriminately damages cells, whether they are malignant or normal, but has the most profound effects on rapidly dividing cells. Osteoradionecrosis of the mandible is a severe iatrogenic disease of devitalized bone caused by radiation therapy of oral and oropharyngeal cancers. Although the risk is low, it increases dramatically if a local surgical procedure is performed within 21 days of therapy initiation or between 4 and 12 months after therapy. Osteoradionecrosis occurs in approximately 9% of patients who receive more than 7,000 centigyri of ionizing radiation to treat a head and neck malignancy. Etiopathogenesis. Radiotherapy affects the small blood vessels of bone, inducing inflammation or end arthritis, which favors the generation of small thrombi that obliterate the vascular lumen and thus interrupt tissue perfusion. There is an increase in free radicals and altered collagen synthesis. The bone loses its normal cellularity and undergoes fibrosis. There is atrophy with impairment of its repair and remodeling capacity. This results in permanent damage to the osteocytes and microvasculature system. The altered bone becomes hypoxic, hypovascular, and hypocellular. These patients may develop soft tissue necrosis as a further complication. Let's look at the management of osteoradionecrosis. A newer radiation technique called intensity modulated radiation therapy has been reported to result in a lower incidence of mandibular osteoradionecrosis. Marks and Ames proposed an approach called the Wilfred Hall protocol, which consists of 3 stages. Stage 1, 30 consecutive treatments. If the wound shows no definitive clinical improvement, further 10 exposures are given to a full course of 40 exposures. If there is failure to heal after 3 months, the condition is advanced to stage 2. In stage 2, the exposed bone is removed by alveolar sequestrectomy and further 20 HBO treatments are given to a total of 60 exposures. If wound dehiscence or failure to heal occurs, the patient is advanced to stage 3. The criteria for stage 3 category are failure of stage 2, pathologic fracture, orocutaneous fistula, or radiographic evidence of resorption to the inferior border of mandible. There is also a conservative management option, which includes local saline or chlorhexidine irrigation, systemic antibiotics in acute infectious episodes, avoidance of irritants such as tobacco, alcohol, denture use, and proper oral hygiene instructions. Thank you.